You're watching News Channel 3 live at 9. Each year, breast cancer claims the lives of more than 40,000 American women.
It is considered one of the most common cancer diagnoses for women, but men are not exempt from the disease. This morning, we are live with Dr. Michelle Taylor, the director of the Shelby County Health Department, to learn why screening for early detection is so important. Good morning, Dr. Taylor.
Good morning, Shay and Alex. How are you all doing?
We're well.
We're doing well, thank you. Let's actually start right there. Why is early detection so important?
Listen, early detection is vitally important. I can say as a breast cancer survivor myself that early detection saved my life. I was diagnosed at age 40 and I actually had a mammogram at age 39. Because my mother is a breast cancer survivor as well, and so I knew the importance of getting screened and getting screened early. And that mammogram at age 39 was normal. The mammogram at 40 obviously was not. I had 2 invasive spots and I was stage 2A. And so I can't stress enough the importance for everyone who is eligible to be screened, whether you're a woman of a certain age or a man who has a family history. It is so important to be screened early and as often as your provider says you need to be screened to make sure you can catch it if you do have a diagnosis.
And Dr. Taylor, I know we've spoken about this before, but what about health screenings and the impact of the pandemic? Because a lot of people just, obviously, as you will know better than most, were not coming in to get their screenings.
Well, absolutely. Everybody knows what we've been through in the last 2+ years. At the very beginning of the pandemic, it was because a lot of places just wouldn't let you in. And then, of course, even when things started to open back up, they weren't as open as they were before. And there were a lot of other precautions and a lot of other things that people were dealing with past going in for those routine screenings. And so now we want people to start to catch back up. If you have any cancer screenings that you know that you're eligible for now because you've reached a certain age, please, please, please go and get those screenings and start to get plugged back in with your provider. And you should already be plugged back in with your annual exam. I know a lot of people don't do a yearly exam, but that really is the recommendation to make sure that you're getting checked from head to toe and make sure that there's nothing going on that needs to be addressed.
And Dr. Taylor, another issue here is that some people may be underinsured or not even have insurance at all, but there is help with your help and also the Shelby County Health Department on ways that people are still able to get screenings.
Absolutely. We are so proud of our Tennessee Breast and Cervical Cancer Screening Program. And for those who are eligible, those who are underinsured or uninsured and can't get those routine screenings like they need to, they can qualify for this program at the Shelby County Health Department. And the phone number for more information is 901-545-8720. Together we can beat this thing and we can make sure that everybody is getting screened appropriately.
And Doctor, while we have you here, we have to, of course, ask about this upcoming flu season. Of course, we're dealing with the flu, COVID-19, RSV, this triple-demic, as some people are calling it. How severe could this potentially be for us right here in Memphis and Shelby County and the Mid-South, for that matter?
Well, you know, it really does depend on us doing the things that we know to protect ourselves. Now, we know that especially in the pediatric population, as things have become more relaxed, more people are going around without masks, without taking some of those precautions that we've been taking for the last 2+ years. We know that we have some folks in our population that are more susceptible, particularly our children. And so it goes back to all of those things we know we should be doing. Good hand washing, not coming to work or school if you're sick, so that you're not spreading it amongst other people, and then putting on that mask if you know that you are not sick or yet you are not well, or that you have recently been sick and you don't want to spread it amongst other people. Those are the things that we really do need to be doing. And then, of course, making sure that you're vaccinated. So it is perfectly safe to get your flu vaccine and your COVID-19 vaccine at the same time. And of course, I know that your viewers know that the updated COVID-19 booster is out. And as long as you are 2 months out from your last COVID-19 shot, you can get that updated booster and get your flu shot at the same time.
And doctor, one last thing very quickly here. What about our local hospital systems? How are they dealing with all of this these days? We've heard of reports that, in some other cities, they are pretty much strained. A lot of the operating rooms, the emergency departments, and so forth.
Right now, our hospital system is doing well, but with that said, remember that we want to keep it that way. And so all of the things that I just discussed about before, about us taking individual and collective responsibility, I've been very proud of Shelby County because we know all the right things to do. And we're doing that not only to protect ourselves and our families and our community, but to keep our hospital systems intact so that they can treat people who really are ill and need to be in the hospital.
All right, Dr. Michelle Taylor, thank you very much for being with us this morning and sharing your personal story, especially dealing with breast cancer awareness. We do appreciate it.
Thank you so much.
Good to see you. All right, time now to talk